copy of the bill that we worked on all year long in the Energy and Commerce Committee. And I brought it with me today to show you that I have read this bill, I have highlighted this bill, I have written notes on important parts of this bill, I have put tabs on key parts of this bill, because this is probably the most important piece of legislation I've worked on this year. And that's why I worked hard to get on the Energy and Commerce Committee and the Health Subcommittee, so I'd have an opportunity to be at the table when important decisions were being made that were going to affect each one of your health care. But this bill didn't just drop out of the sky one day, and that's very important. So what I'm going to do today is I'm going to start out and talk to you a little bit about what's in this bill, how it came about, and where it's going, so that you will be able to know a little bit more, hopefully, at the end of this presentation before we start talking about the questions and concerns you have. So this is a little overview of what all I've been doing on healthcare since this Congress started up in January. We've had multiple hearings. We had one on March 10th with 6 witnesses, March 17th with 8 witnesses, March 24th with 8 witnesses, including Dr. Mike Kitchell, who's a neurologist from Ames, Iowa. Dr. Kitchell is the president-elect of the Iowa Medical Society, and one of the things that I'm going to be talking about is this significant problem that affects healthcare for every Iowan. And that's the fact that right now the reimbursement system under Medicare disproportionately penalizes healthcare providers in Iowa who consistently rank at the top in terms of quality of healthcare outcomes and at the bottom in terms of reimbursement rates. And that's why Dr. Kitchell came out and testified, so that we can try to solve that problem. We had another hearing on March 31st about the role of public health, which is increasingly playing an enormous role. We saw that happen in the aftermath of the tornado here in Parkersburg and in the flooding throughout the state. Another hearing on April 2nd where we had 10 witnesses testify. And then on June 19th, the first healthcare discussion draft was introduced in the House. And that was a bill that was put together by the committees of primary jurisdiction on healthcare. And that's the one I serve on, Energy and Commerce. It includes the Ways and Means Committee, which is the tax writing committee in the House. And it also includes the Education and Labor Committee to deal with a lot of the healthcare workforce issues. And as you know, in a state like Iowa with our declining or stagnant population, the need for healthcare workers is a very important priority. So then after that, we came back and we had more hearings. We had a hearing on June 23rd with 11 witnesses, June 24th with 16 witnesses, and June 25th with 23 witnesses. And these witnesses talked about the entire spectrum of healthcare delivery in this country and how we pay for healthcare both through private health insurance plans and public health insurance plans, like Medicare and the VA. In addition to all of these hearings that I've attended, I've also been holding town hall meetings throughout this process. My first one was in Cedar Falls talking about chronic disease at the Wellness Center, then 2 in Dubuque and Oldwine on July 6th, another one in Davenport, Waterloo, Independence, and today we're here in Parkersburg, and then I'm going to Waverly. By the time I go back to Washington after the Labor Day recess, I think I will have held 15 telephone town hall meetings. In addition to these in-person ones, we've also done 2 telephone town hall meetings with almost 5,500 people who participated by phone. Then on July 14th is when we got the draft bill that we're talking about in the House, H.R. 3200. And after this bill was finalized, we had in the Ways and Means, or the Energy and Commerce Committee, 5 full days of markup. And that is a time when representatives on both sides of the aisle, Democrats and Republicans, offer amendments to the bill. We debate those amendments, and then we vote on them. And one of the things that's very important to know about those markup is that there were Democratic amendments offered and rejected. There were Republican amendments that were offered and accepted. And one of the critical things that I worked on, dealing with this healthcare reimbursement inequity, I worked with Lee Terry, a Republican from Omaha, because Nebraska healthcare providers face the same problem as Iowa does in consistently getting underpaid for high quality of care. So that bill was then voted upon on July 31st after 8 days of hearings, 89 witnesses, and 5 full days of markup. One of the things I've tried to do throughout this process is make information available to my constituents at my website, braley.house.gov. So as soon as that draft bill was introduced, it appeared on my website along with a summary of the bill. Every one of the hearings that we've had are summarized on my webpage. And you're able to go there, you can download the whole bill if you want to. If you're having trouble sleeping at night, you can download summaries of the bill, and you can also go there and watch some of the PowerPoint presentations like I've been giving around my district. And I just want to point out that healthcare button is right on the home page. So if you go to braley.house.gov, all you have to do is click there. It will take you to this page, and it should have some of the most current information available about what's going on in the House on healthcare. So when I set out to be part of this conversation about healthcare reform, these were the top priorities that I brought to the table with me. 1, improving quality. 2, promoting efficiency. And a lot of people get confused with efficiency and cost. In a medical economic setting, efficiency isn't just cutting costs. What it means is providing the highest level of care at the lowest cost over the lifetime of a patient. So part of what we're trying to do with this new model of healthcare is to promote efficiencies, because most medical economists have identified enormous waste within our system, specifically in certain areas of the country where healthcare costs are out of control. And I can tell you where they are. Places like Louisiana and Mississippi and Florida and Texas, parts of California and New York. Controlling cost is related to that, but improving access and affordability. And one of the most important things we know is prevention and wellness. Right now, we spend 70 cents on every healthcare dollar on chronic diseases. Things that are related to obesity, diabetes, congestive heart failure, high blood pressure. 70% of our healthcare dollars go to chronic disease. And the important thing about that is most of those diseases are treatable or preventable. And that's why moving in a direction that promotes prevention and wellness and actually provides incentives to people in the healthcare delivery system to promote prevention and wellness could save us billions of dollars in healthcare costs over the long term. Shared responsibility. This is another one of the key elements, that when people are required to share in the decisions that are made about their healthcare, they typically make better decisions, and when they have to share in the cost of their health care, they make better decisions about how they use or abuse health care. So that's another important principle. And then workforce investments to address shortages, and I'll be talking about that in a little more detail. So how does those reform, how do those goals get accomplished in this bill? One of the things that is part of this bill is the establishment of something called a health insurance exchange. And it's designed as a new option for everyone. That includes individuals and employers. And what it does is it creates a marketplace for businesses or individuals to go and purchase their health insurance from competing plans, and that could include a private plan or a public health insurance option.